just to remind you that we are on agenda item 5, and just before the break we were finishing the panel debate as an introduction to sub-item A, and we will now open the floor for interventions by member states. And please indicate if you want to speak to agenda item 5, sub-item A, which is lessons learned from Health 2020 implementation. Who wants to take the floor? Thank you very much. Germany has the floor, to be followed by Montenegro.
Vielen Dank, Herr Vorsitzender. Abgestimmtes Handeln ist zentral für die Umsetzung der Agenda 2030 und zur Erreichung der gesundheitsrelevanten Nachhaltigkeitsziele. Wir sind uns sicher, dass der globale Aktionsplan zu SDG 3 dieses abgestimmte Handeln befördern wird. Er ist deshalb richtungsweisend für künftiges Handeln im Bereich der globalen Gesundheit. Es ist eine Chance für die WHO, ihre wahrgenommene Führungsrolle bei der Erstellung des Plans, auch bei der Umsetzung des globalen Aktionsplans auszuüben. Auch für die europäische Region ist dieser Aktionsplan eine besondere Richtschnur für Strategien und abgestimmtes Handeln. Deshalb freuen wir uns auf die Vorstellung des Aktionsplans in einer Woche in New York und die folgende Umsetzung auch in unserer Region. Wir müssen auf Länderebene Fortschritte erreichen. Dabei sind die Übernahme von gesundheitspolitischer Führung, Gesundheitskompetenz und gesundheitlicher Chancengleichheit wichtige Faktoren. Das hochrangige Treffen der Vereinten Nationen zu allgemeiner Gesundheitsversorgung in New York verdeutlicht, dass die Erreichung der allgemeinen Gesundheitsversorgung ein gemeinsames, übergeordnetes Anliegen ist. Unsere Debatte sollte qualitative Aspekte der Gesundheitsversorgung verstärkt in den Blick nehmen. Denn es zählt, dass Menschen qualitativ gut versorgt werden. Das gilt sowohl lokal, national, regional als auch global. Deutschland begrüßt die erzielten Fortschritte und Impulse durch das Rahmenkonzept Gesundheit 2020 und den Beitrag zur Erreichung der Nachhaltigkeitsziele. Wir unterstützen die Betonung der erforderlichen Bürgernähe von Gesundheitssystemen, denn es geht ja darum, den Bedürfnissen der Bürgerinnen und Bürger gerecht zu werden. Dabei spielt die Einbeziehung der Zivilgesellschaft eine entscheidende Rolle. Die Stärkung von Gesundheit und nationalen Gesundheitssystemen sollte sich auch in Zukunft stets an der Situation des jeweiligen Landes orientieren. Lokale Ansätze sind oftmals am besten geeignet, die individuellen Bedürfnisse der Patientinnen und Patienten zu adressieren. Um Gesundheitssysteme kontinuierlich zu verbessern, ist die Analyse der Versorgungsprozesse anhand klar definierter Zielsetzungen notwendig. Die Festlegung dieser Ziele sollte gesamtgesellschaftlich erfolgen. Dabei sind Führungskompetenzen eine entscheidende Voraussetzung dafür, dass diese Debatte transparent, strukturiert und ergebnisorientiert verläuft. Wir begrüßen die Erfolge, die in der europäischen Region bereits erzielt werden konnten. Wir stellen allerdings auch fest, es ist noch einiges zu tun. Die Berichte zum Thema Chancengleichheit zeigen uns, wie wichtig die Stärkung von Gesundheitskompetenz ist. Niemand darf zurückgelassen werden. Ein starkes Gesundheitssystem vor Ort muss gesamtgesellschaftliches Engagement einbeziehen. Deutschland unterstützt die Resolution. Vielen Dank.
Thank you very much, Germany. I give the floor to the delegate of Montenegro, to be followed by Lithuania.
Your Excellencies, Mr. Chairman, Madam Regional Director, Honourable Ministers, ladies and gentlemen. I'm speaking in front of 9 member states of the Southeastern Europe Health Network who have associated themselves with a statement Albania, Bulgaria, Bosnia and Herzegovina, State of Israel, Republic of Moldova, Montenegro, Republic of North Macedonia, Romania, and Republic of Serbia. Southeastern Europe Health Network member states individually and in joint alliance have dedicated remarkable efforts to implement Health 2020 by developing and implementing national health policies aligned with Health 2020. The commitment to intersectoral government policies has almost doubled. Over the last 7 years, Health 2020 has served as central framework for whole of government, whole of society approaches for enforcing and developing to drive national and sub-regional policies. Example of the Southeast Europe Health Network perfectly represent the added value of partnership towards actions aimed at improved public health and universal health coverage. Our network has proved to be effective regionally in mobilizing the political momentum and to ensure commitments throughout the 4th Health Minister Forum, Health, Well-being and Prosperity in the Southeastern Europe, held in April 2017 in Chisinau, Republic of Moldova. Throughout the outcome document Chisinau Pledge, each country has committed itself to undertake a joint initiative with the networks and its partner support in order to integrate the SDGs agenda into their own national planning process. Leaving no one behind has been set as a core value into commitments undertaken under the Chisinau Pledge. Ladies and gentlemen, in this respect, we strongly support the proposed draft resolution on accelerating progress towards healthy, prosperous lives for all, recognizing that no single one-time intervention could possibly eliminate health inequities. In conclusion, I'm pleased to state here that we are sustaining, launching a regional health equity solution platform and strengthening the regional partnership for health by taking deliberate action to influence governance in other policy grounds to make the case for health. At the end, I want to use this opportunity to say that we highly appreciate support from dear Director General and Deputy Director General, Dr. Jakab, for our network as an excellent example of regional cooperation. Thank you for your attention.
Thank you very much, Montenegro. Lithuania to be followed by the delegate from Slovakia.
Thank you, Mr. Chair. Lithuania wishes to thank the Regional Office for the explicit report on the progress achieved in implementing the Health 2020 policy framework in the WHO European region, as well as the efforts made to support its implementation in member states. Health sector is affected by a lot of challenges as integrated care, elderly care, rapidly expanding technologies, higher quality and safety requirements, rapidly expanding patient expectations, and many others. Long ago, it became clear that state all alone is not able to overcome such challenges. Therefore, the policy in responding to these challenges was needed at all levels, regional, national, and local. Health 2020 served as good basis for evidence-based guidance and updating national health policies, as well as on addressing key challenges and promoting health and well-being in the region. The principle health in all policies created added value by building and strengthening partnerships at regional, national, and local levels. The development of health in all policies principle by implementing the whole of government and whole of society approaches provided the opportunity to change the predetermined standpoint that health is a responsibility of a single ministry. It provided a strong evidence that health is not just a value itself, but also a precondition for economic, environmental, and social prosperity. Lithuanian health strategy was based on provisions and values inherent in the Health 2020. The comments provided by the WHO Regional Office for Europe on the draft of the program ensured that it reflects best available evidence, current thinking, and performance measures as outlined in the policy framework and to be adopted to the governance and health priorities of Lithuania. The proposed draft resolution clearly outlines the importance to strengthen leadership in health policy and practice, to promote policy coherence and sustainability at all levels and between sectors, to continue to develop and align our policies and action plans towards implementation of the 2030 Agenda for Sustainable Development, to continue building strong partnership and other important aspects. Lithuania strongly supports these aspirations and the draft resolution. Thank you.
Thank you very much, Lithuania. Slovakia to be followed by Sweden.
Distinguished Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. Slovakia strives for achieving the common goals and continues strengthening leadership in health policy and practice in order to reach better public health results. We strongly recognize a need for better health for the population and better care for the individual. We have already made some progress, but we also have a lot to accomplish. We consider as inevitable to push for a change that promotes innovations using an evidence-based approach. Despite our well-documented knowledge about health inequality, the policy implementation requires many other elements to be effective: political will and commitment, collaboration, resources and governance, in line with integration of health aspects into correspondent policies interlinked with the health sector. We strongly recognize the importance of policy coherence across all fields, with the aim to make other sectors aware of the impact their policymaking has on the health outcomes. Governing through collaboration should become a new imperative for us, given that it would facilitate the process of addressing health inequalities and achieving greater equity. In conclusion, we would like to accent the importance of health literacy as the determination of health, which has a relevant impact on health equity. Alongside, we highly appreciate the role and work of WHO Action Network on measuring population and organizational health literacy. Slovakia entirely supports the proposal of the resolution. Thank you.
Thank you, Slovakia. Before I give the floor to Sweden, I would like to see if there are any more member states wishing for the floor. United Kingdom, you took down your sign. Thank you very much. So when Sweden is speaking, I would ask any other member states wishing to take the floor to put up their sign. Otherwise, I will close the list. Sweden, you have the floor.
Thank you, Mr. President. The Health 2020 framework puts focus on the need to address the key public health challenges and opportunities to promote health and well-being. It reflects on the complex nature of health determinants, as well as the necessity of political leadership to address them. The spotlight is on shared responsibility and requirement of measures from different sectors at all levels in society, including monitoring and evaluating implementation. Summarizing the years that have passed since its adoption and the lessons learned, we can conclude several crucial events and activities that have been carried out. In June 2018, the Swedish Parliament adopted an overarching objective of public health policy, with a clear focus on health equity throughout the population, with the goal of reducing the avoidable health inequalities within a generation. In addition, the public health policy renewed cross-sectoral targets and follow-up structures. The Swedish government has also adopted a gender-equal health as a sub-goal for gender equality. Several initiatives to reduce health inequalities have been carried out at local and regional level in Sweden. The main point of departure has been the WHO Commission on Social Determinants and its final reports closing the gap in a generation. The Health 2020 framework has further enhanced these initiatives, especially when it comes to implementation of actions. I would like to point out the work of the European Review of the Social Determinants of Health and the Health Divide that inspired several national initiatives on health inequity based on the social determinants of health. We are pleased that the European region now has action plans and strategies on different health challenges in place, all in line with the Swedish strategy on our collaboration with WHO. Not the least for bringing together the European environment and health processes as a unique intersectoral policy platform. Within the Nordic and Baltic context, we are pleased that the Health 2020 framework has been a catalyst to strengthen our collaboration. For example, by the sub-regional meeting in Stockholm in 2016 on the implementation of the Health 2020. We are also happy to have elaborated the first Nordic declaration on health equity through the Trondheim Declaration, addressing the need to do something, to do more, and to do better in reducing health inequalities. As the Health 2020 policy framework is soon to be concluded, we encourage you all to take on the SDGs, leaving no one behind, as well as the GPW 13, as our visionary goals for promoting development with health and health equity at the center of our work. Thank you.
Thank you, Sweden. I have no more member states requesting the floor, so we'll now turn to observers. I have 4 observers on the list. First is Ms. Maike Droger, who has a joint statement on behalf of 15 non-state actors. Ms. Droger, you have the floor.
Thank you, Chair. Dear Regional Director, dear Honourable Ministers and guests, dear colleagues. The European Public Health Association and the 17 undersigned organizations welcome the decision to place health leadership on the agenda. UFA and undersigned organizations strongly support the central thesis of the accompanying document that public health requires strong leadership. In addition to the relevant examples of health leadership in the document, we present additional key concepts that should guide public health leadership, both on institutional level and on individual level. Firstly, ethical leadership. Ethical leadership is the kind of leadership that takes into consideration the needs of all people, does justice to everyone, respects all those affected by the actions of leadership, and is about taking responsibility for all people. We need courageous leaders who are willing to stand up for these health goals. Secondly, leadership is about listening to all the perspectives that partners bring to the table on a health-related issue, and it's a skill that is needed when working across sectors. In our globalized world, health leadership requires entering into dialogue also with other regions of the world, including Africa. Thirdly, health leadership needs to create a strong public health narrative. This is needed to convince that health is an investment rather than a cost burden. We like to highlight the importance of scientific evidence. It is the scientific rigor that brings quality and trustworthiness to the evidence, and it is this factual information that health practice and policy should be shaped by. Health leaders should ensure that practice and policy is based on scientific evidence. Last but not least, we need to prepare the future generation for their leadership role. We have confidence that the listed key concepts of health leadership are familiar to member states, staff members of WHO regionally and globally, and WHO's many partner organizations and institutions. In particular, we have confidence that the newly elected regional director of WHO Europe will incorporate the listed key concepts for health leadership. UFA and the undersigned organizations are ready to support WHO Regional Office for Europe in their public health leadership role. Thank you.
Thank you very much. Next is Mr. Howard Catton with a joint statement on behalf of the International Council of Nurses and the European Forum of National Nurses and Midwives. Mr. Cotton.
Thank you, Mr. President. I am a nurse and the CEO of the International Council of Nurses, and I speak on behalf of ICN, the European Forum of Nurses and Midwives, and European nursing students. We strongly support continued efforts to strengthen leadership in particular with regard to the nursing and midwifery professions. In recognition of the vital role of nurses and midwives to the health of our world, the World Health Assembly has proclaimed 2020 to be the year of the nurse and the midwife, and to celebrate the bicentenary of the birth of Florence Nightingale, and to raise awareness of the vital contribution of nurses to public health. Given the current global nursing shortage, we urge governments and health sector employers to invest in nursing and midwifery leadership, education, recruitment and retention strategies, and for the removal of barriers to advanced practice roles that are proving highly effective at expanding healthcare coverage and access. We commend WHO for developing the first ever State of the World's Nursing report, and we strongly urge ministries of health to proactively contribute to the report and nursing leaders to be actively engaged. We congratulate and we urge the future regional director to establish the role of Chief Nursing Officer at the WHO European Regional Office. And we call on ministries of health to establish and empower government chief nursing officers to lead the nursing and midwifery workforces and to provide nursing and policy advice to health systems and political leaders. Thank you.
Thank you very much, Mr. Catton. Ms. Paulina Birula, on behalf of the International Federation of Medical Students Associations.
Thank you. My name is Iris Blom. I'm from the Netherlands, and I will be reading this statement on behalf of the International Federation of Medical Students Associations and the European Medical Students Association. We value the discussion of the contribution of leadership in health policy and practice. We believe that, in order to foster successful future decision makers and health advocates, it is essential to include global and public health education in the medical curriculum. In the world of today, no health issue can be targeted successfully without realizing its international context. We call on member states and non-state actors to implement global and public health education as a necessary and vital component of medical education, raising a generation of health professionals and leaders who are able to deal with public health emergencies in a more efficient way. In addition, the IFMSA makes a conscious effort to increase gender equity and diversity amongst leaders. Currently, women make up 52% of physicians in this region. However, only 30% of health ministers are female. We call on member states to develop and implement strategies to increase the representation of women and people from diverse cultural and religious backgrounds in all decision-making organs and in leadership positions. Such efforts should be carried out through a dialogue with the aforementioned groups, so that all people may have access to their human rights of expression, safety, education, marriage, and equal opportunity to participate in the workforce and contribute to socio-economic development. To conclude, young people, educated, empowered, and engaged, will be and are the new leaders today and tomorrow. Youth have shown their ability and capacity to be the positive change agents who can address and help solve the emergent issues we face today around the world. Youth have the potential to contribute towards building resilient nations whilst ensuring sustainable human development and quality of life for generations to come. Therefore, we call on all member states to ensure meaningful youth participation, which requires that individuals are entitled to participate in the decisions that directly affect them, including design, implementation, and monitoring of these interventions. Thank you.
Thank you very much. The last speaker is Mr. Mike Donby on behalf of the IOGT International.
Thank you, Chair. Honorable Chairperson, distinguished delegates, it's an honor to address you on behalf of the members of IOGT International. We commend the Secretariat's report and analysis. The Health 2020 policy framework has been a significant achievement for its all-determinants approach and for positioning this region well to achieve the SDGs. At the same time, analysis of the 4 priority areas shows that even Health 2020 has fallen short in some aspects. Health has not been properly mainstreamed into all other policy areas. For example, trade takes too often precedence over health. Health for all is still not a reality for many people in Europe, as progress on health equity is stalling. For example, alcohol harm has been highlighted in the report as an obstacle to 3 of the 4 priority areas. This shows that systematic action to address cross-cutting health risk factors would reap substantial benefits across key health priorities. Investing in population-level prevention of health risk factors should therefore become a priority. The alcohol policy best buys, for instance, yield a return of €8 for every €1 invested. Such investments should serve to unlock resources for health promotion. We call on governments to make population-level prevention and health promotion a cornerstone of the efforts to achieve health for all and many other SDGs. To guide this work, we urge Member States to support WHO Europe with more resources in order to respond to the need for technical support in health policy best by formulation and implementation. I thank you for your attention.
Thank you very much. We have now concluded the interventions, and we can now consider the adoption of the proposed draft resolution, which is contained in conference document EUR/RC69/confdoc/11, titled Draft Resolution on Lessons Learned from the Implementation of Health 2020, the European Policy Framework for Health and Well-being. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objections, so the resolution is adopted.